Laura is a 3-year, 6-month-old preschool child with mild stuttering. Her parents first noticed an issue when she had a large vocabulary explosion at 2 years of age. In addition to her parents' concerns, Laura's preschool teacher also noticed some abnormal disfluencies. She was evaluated at the Yukon Speech and Hearing Clinic, where no comorbid speech and language disorders were found. She was ultimately diagnosed with a mild fluency disorder characterized by whole word and part word repetitions, prolongations, and blocks. The following session is part of a 45 to 60-minute weekly session. Laura is in stage 1 of the program, where the goal is no stuttering or almost no stuttering.
Hello, Miss Michaela. Good to see you today. Hi, Laura. We are going to have lots of fun today. Here are some toys to play with while I talk to Mom for a little bit. So, Miss Michaela, how has the past week been? Do you have your rating log from this week?
This week was okay. Laura had a little trouble on Monday and Tuesday because our schedule was disrupted because my father came for a visit. Laura was doing so well on Monday and Tuesday, but there is a big increase in disfluency.
Well, it's great you noticed a difference in disfluency and identified a possible variable in the environment that could have been contributing. What did you do when there were many disfluencies on Monday and Tuesday?
I use praise the most to praise fluent speech. I also had a conversation with my dad about the work we're doing here so we could participate in the program. He was very excited that I included him in the treatment.
Excellent! I'm glad to hear you continue to utilize verbal contingencies and that you included another person in the household in the treatment program. Did Wednesday seem better in terms of fluency?
Yes, I noticed that fluency was much better on Wednesday and Thursday. I was very happy to see the improvement.
Excellent! Great work with treatment this week at home. Keep up the great work next week and don't forget to keep up with your log each day.
Okay, thank you.
So today I want to introduce another verbal contingency for you to use. The contingency is called Request for Self-Evaluation. This contingency asks you to ask Laura if speech was smooth or if there were any bumps after an episode of stutter-free speech. You can use this contingency after a long episode of stutter-free speech or after a few hours of stutter-free speech. The goal for this contingency is to get Laura to evaluate her stutter-free speech and reflect on the fact that her speech can be smooth. Does that make sense?
Yeah, I think I understand. Should I keep using praise also?
Yes, we are building a toolbox of contingencies to use, so each time we introduce a new one, we want to remember and continue to use the previous ones as well.
Okay, great.
Ready to give it a try?
Yes.
Hi, Mom.
Hi, Laura.
Dinosaur's riding on a cow.
Hi, Mr. Cow.
Put pig in the tractor.
Pig in the tractor. Duck in the tractor.
Ooh, pretty dinosaur. Nay! Nay! I love horses.
Was that speech smooth or bumpy?
Smooth!
Good job.
Great job, Miss Michaela. I love the way that you asked for self-evaluation there. That was a great use of that contingency.
Thank you.